Hello, good evening, and welcome along to the first of a series of 2 engagement events relating to the Cardinal Medical Practice. My name is Simon Morgan, Head of Communications for the 3 CCGs across Suffolk and North East Essex. We're running this engagement event in conjunction with the Cardinal Medical Practice, so you're very welcome this evening. We are recording this event as well for any member of the public or any stakeholder who can't be with us this evening to watch in their own time. And of course, if you do have any questions, please do email the practice, the details of which are on the Cardinal Medical Practice's website. So we are here this evening to share with you a bit more information about the practice's proposal to amalgamate three practices in Northwest Ipswich into a new large purpose-built facility on the old Norwich Road, formerly occupied by the Tooks Bakery. So we'll be coming on to that in just a second. I'm going to introduce you to our panel this evening who are with us. So starting off, please, with James Kukiara.
Thank you, Simon. I'm James Kukiara. I'm the Managing Director for Suffolk Primary Care.
Thank you, James. Dr. Donna Pudi.
Good afternoon. Thank you, Simon. I'm Dr. Donna Pudi, GP partner at Cardinal Medical Practice, part of Suffolk Primary Care.
Thank you. Eunice.
Hello, good evening. I'm Dr. Eunice Ifeonu, one of the partners at Cardinal Medical Practice and a partner of Suffolk Primary Care.
Thank you, Eunice. Andrew.
Good evening. I'm Andrew Preston, General Manager of Cardinal Medical Practice.
Thank you, Andrew. And Stuart Edgar.
Good afternoon. Stuart Edgar from KLH Architects, Associate Director and Architect on this project.
Lovely. Thank you very much indeed, Stuart. So that's our panel for this evening. We will be inviting members of the public to submit their questions. Questions through the chat, please, by typing them in. We will, of course, address all questions or answer all questions in a courteous and respectful way, and we would ask you to put your questions to us in a courteous and respectful way as well, please. So let's make a start on this evening's presentation, and for that, I'm going to hand over to James. James.
Thank you, Simon. If we could just go to the next slide. Perfect. So just giving you a bit of background as to why we're here, really. So the proposal is to move the current 3 sites into a single purpose-built premises. The 3 practices merged back in July 21 of last year. The proposed location for this new site is on the Tooks Bakery building. It's the old Norwich Road. It's only about a mile between the current practices. It's been selected because of its space and ease of access for patients. The Norwich Road building will remain open. It will predominantly be administration, but there will be some triage services out of those premises as well. The Deben Road site and Chesterfield Drive sites will close permanently. Why this site? It's been designed to accommodate the expected growth in population in the area that is expected over the next few years. It's obviously purpose-built, modern. It will allow the practice to develop the services that it provides. It will also allow to expand in terms of teaching and training, and it also sort of eliminates the issues that are currently at the current buildings and premises, which are related to car parking is a major issue at the current premises, and the current premises do not have the capacity to be extended any further than they currently are, so there is no additional capacity for clinical or administrative space on the current premises. Next slide. So the benefits of the proposed new site. So it's the site is formerly used as Tooks Bakery. So the development will also cater for residents who live in a nearby housing. As I said, development of new services, increased opportunities. See a nice modern building for one of the largest practices in the area will hopefully enable us to increase our recruitment and workforce development. Car parking for patients, as we know, is a current issue at all 3 of the sites, and this will alleviate that problem, and it's got good travel links.
Thank you very much indeed, James. So this is my bit now where I'll come in just to tell you a bit about how we've promoted and how we've been working to promote the engagement over the past 2 months or so. Just another quick reminder, if you have got any questions about any aspect of what you're hearing this evening or anything that you'd like to put to our panel, please do type it into the chat. We will pick it up this end and we will ask the panel questions on your behalf with answers given during the course of this evening's update. So the promotion of the engagement, you'll be aware that we're finding out people's views, patients' views about these proposals that you're hearing. We've been doing that through a survey. That survey's been on the practice's website. We've been promoting that survey quite far and wide in various forms. We've been issuing press releases over the past couple of months, particularly at the start of the engagement, because obviously we've been having the pre-election period over the past 6 to 7 weeks, so we've been promoting it through social media, but our press releases were issued around the early time of the engagement. So we've been highlighting ways to get involved, ways to find out more information, and how to pass on your feedback accordingly. We have also issued very closely and working very closely with the practice quite a few social media messages as well, again reminding people about the fact that this proposal is being considered, and again how to get involved. There's quite a lot of information on the practice's own website, Cardinal Medical Practice Group's website, and you'll see on there not just links to the survey, but also easy read documents. There's also plans and links to the plans, plus also a sentence or two which has been translated into 4 of the most commonly spoken languages in that part of Ipswich as well, which urges people that if they want to find out more, if they want communications translated into their mother tongue, then to get in touch with the practice, and we'll arrange that accordingly. There's been some press articles as well. We're very grateful to our media colleagues for the support that they've given and the coverage that they've given in relation to the plans, particularly in the early stages of the engagement. The East Anglian Daily Times, the Evening Star have been very helpful in promoting that for us, so thank you. There's been a number of adverts as well, most recently last week and this week, promoting these 2 live events in the Evening Star, so we took those out. We've also had good support as well from our Health Watch colleagues who are and have been lining up some engagement sessions and site visits to the practices where they'll be speaking to patients as well to get that lived experience story, and also to get people's views as well on these proposals. There's been posters that have gone on display and put up in the practices. As I said, there's been easy read document as well that's been uploaded onto the website, translated information on the website, and there's also been briefings for councillors and also health and overview scrutiny committee members at Suffolk County Council and also Ipswich Borough Council as well. So we're very grateful for the support and interest that we've had so far, and hopefully we'll continue with that. If we can go to the next slide, please. Just wanted to share with you some of the coverage that I've just mentioned there. You'll see there the East Anglian Daily Times on the 21st of March, plans for super surgery to replace 3 sites. That appeared then right at the start of the engagement, and that was a helpful article which also promoted the fact that the engagement had just started. And if we go on to the next slide, an example of another piece of coverage on the 24th of March, where the headline was "Huge interest in super surgery and bus route plans addressed" as well. And on to the next slide, please. We seem to have lost the slides. There was one more slide anyway. I was going to show you the adverts that have been taken out in the local newspapers as well, promoting these engagement events, but we'll have to show that to you another time. Okay, and with that, let's go on to... No, okay, let's go on to Stuart anyway. Stuart, over to you.
Thank you, Simon. Okay, I'm going to share my screen. We have previously been involved with public consultation event of our own. This is something that was required as part of the upcoming planning application. It happened about a month ago, and some of you may have seen this already. Some of you may have met me on one of our 2 public engagement sessions that we had. So I'm going to talk you through the boards that we presented on that day, and these will also be available, as Simon said. They've been on display at the GPs themselves. They're available online, and that will remain for the time being while this engagement process is ongoing. So the site location, It's the old Took site. We were also the architects involved with the development of the north site on the Took's development. That got planning permission in 2018 and it was built in 2020, completing just before Christmas. And that was a housing scheme. When that application went in, it was part of the planning application that a route through to our phase 2 site, which is where the healthcare practice will be. It was known at that time that the GPs would be sited here, or that a healthcare facility would be sited here. So the access is not off Bury Road, it's off Old Norwich Road through the new estate and then onto our site. There will be 2 access points, one the car park site through the existing residential area, and there will also be a footway and cycleway access on the south of the site off of Bury Road on the corner, benefiting from the transport links bus stops that already exist there. In preparation for our planning application, we have arboricultural, that's tree surveys underway, same for ecology. At the moment, the site is generally barren. This is the old Took site, so we have the building removed, but there is still slabs there. There's very little environmental benefits in keeping the site as it stands, so we have an opportunity to improve the environmental aspects and biodiversity by actually putting a building here. Access and transport statements, we're also underway with transport statements. We have bus stops already on Old Norwich Road and slightly further down to the south of the site as well on Old Norwich Road. And we will be providing car parking spaces as well. So as you drive into the site from the north through the housing estate, we have provisions for disabled parking bays. We have 20 staff spaces to the rear of the site and 75 public and patient parking spaces, as well as 2 lots of cycle storages. So 1 cycle area for public and patients to use and a separate one for staff to use as well. The secondary entrance via footway is to the southeast of the site through the trees. We would need to have some improvements made as well as part of this proposal to the footway that currently comes around the corner of Bury Road and Old Norwich Road. And then the entrance from the car park would be in the corner here. The building itself is formed from 2 wings, one that flanks Old Norwich Road, one that flanks Bury Road. And then where they join in the centre, we have on ground floor entrances, and on first floor we have waiting spaces. Before I skip to the next slide, we're also showing some photovoltaic cells to create on-site energy, on-site electric on the roof. These are indicative at the moment. Once we get the planning permission, those sort of levels of detail come at the next stage. So proposed ground floor plan, car park in this section, coming through an entrance into a shared lobby. And we have a wing, first wing here on the north for GPs, clinics and patient use. In total, we have 29 clinical rooms. We have 11 nurses' rooms. We also have a minor operating suite. So this may negate some local users from having to travel to hospital for minor surgery uses. We also have on the ground floor lift access and stair access to first floor. Coming through past our reception and admin area, we have the first of our GP's areas and a subwait. Each area has been generally designed in the same way. This is to current HTM and HBN standards. This is also a new building, so we're at current building regs levels, much more sustainable in terms of energy efficiency than the existing practice buildings will be. Also on ground floor, we have a third-party operated pharmacy, which has its own dedicated entrance from the car park side. And then to the left-hand side on plan here, we have staff areas. So we've got training suites, we have staff changing areas, staff restrooms, plant room, and the training suites I'll just touch back onto. We've designed as much flexibility for use as we can here. So we have movable partitions internally. So this could be 3 or 4 smaller rooms, it could be 1 larger room. This will benefit the use in future. When we had the pandemic hit in the last few years, some practices were struggling to offer vaccinations because of the way the buildings limited use. This would actually give us direct access from the car park, so we'd be able to have patients coming in and out via a circulation route without having to go through the main entrance of the hospital, of the GP's practice, sorry. So it's designed with flexibility. This could also be used for practice group meetings, staff training areas, but also for patient groups, maternity groups, if those sort of things are offered in the future. First floor plan, so coming up the stairs or coming up the lift, we have a shared waiting area overlooking the south side of Old Norwich Road, and then going off the north and the west areas of the corridor here, we have similar to we've seen on the ground floor already, so they're designed in very similar manners. We have a central subwait in each area, which would benefit from roof lights, so we still have natural light in these areas. And then branching off of the subwaits, we have clinical rooms and practice care nurse rooms as well. Each of the clinical suites has dirty utility, clean utilities, WCs, stores, waste holds, minor staff facilities as well. Again, this is to current standards, so I would expect the rooms are larger than are currently being achieved in the practices as we stand. And again, as a new building, we have the opportunity here to actually have greater standards than just building regs requires us to do. So an NHS requirement or client requirement for this one was to hit BREEAM Excellent, which is a really high standard in terms of thermal efficiency, energy uses. So this is going to be a sustainable development as well. This is a couple of proposed renders, and I'll talk through the materials briefly. So as mentioned previously, we have already fulfilled the housing development to the north of the site, and we've used the materials that exist there as our precedent for the site here. So we have a mixture of buff brick, and here we have vertical vertical metal standing seam cladding. The window patterns are arranged as large windows, but they would be sealed units for privacy, for sound, and again to help our building efficiency in terms of energy usage. This is the entrance as it stands on the south. So this is the pedestrian access coming in, and you have an overhang from the waiting room on the first floor, giving cover to a ground floor entrance. The car park side, second entrance, is in the corner where the two buildings meet. And you see one of these buildings is entirely brick clad. The other is a darker grey brick. So we have buff brick on this two-storey element, a darker brick to the lower level of the other building element, and then vertical standing seam metal cladding on the first floor. This is where we envisage the pharmacy entrance to be, and it would be a separately operated building. And it's also not showing my previous slide. Okay, we did have another 3D view to show from the sky there. I don't know if Sarah might have any better luck at getting those on screen than I have, but my tech is failing me. It's not letting me show the last slide, unfortunately.
Is that proposed aerial views?
Yes.
Yep, I can get that up. 2 seconds.
Thank you, Sarah.
I think the gremlins are at work this evening. Just a quick reminder while Sarah's finding that slide, please do submit your questions in the chat. We haven't had any questions yet, so obviously if we don't get any questions, we will bring this to a close earlier. So please do type your questions into the chat that we can put to the panel, and then we will make sure that we answer those for you.
Thank you, Simon, and thank you, Sarah, for putting this image on screen. So again, a couple of proposed renders here where we're showing an aerial view from either side of the proposal, and you can see the two masses and as they sort of meet together where our shared areas are, the waiting rooms. Some sections lower left just showing the proposed materials as discussed, the vertical standing seam metal cladding, the darker engineering blue brick on the lower section of that block, and then the buff brick that would be the two-storey brick building element. And hard surfaces, we're envisaging at the moment dark grey paving slabs. Now, as mentioned previously, this hasn't been submitted for the full plan application as yet. We expect that to happen in the next few weeks once we have the last of our third-party consultant information in. Generally, transport statement is the last one that we're waiting for. We do have information back on trees. There would be some minor tree removal just to allow our entrance on the southeast corner. Generally, this site has a lot of TPO, they're protected trees to the boundaries, and we don't want to remove anything more than we need to. And in fact, we'll be adding trees onto the core of the site as well within our car parking arrangement. And that's where we stand currently. So look forward to any questions coming up. Thank you.
Thank you very much indeed, Stuart. Thank you to the panel members as well. We have had one question in, so thank you for that. I've also got one or two other questions that I'd like to put to the panel as well. And perhaps at this stage, I can just bring our clinical colleagues in as well. And Dr. Donna Pudi, perhaps you might be able to answer this one. One of the main messages about this engagement has been around expanding staff training and also teaching as well, that this new build might be able to offer that if it did go ahead. Can you elaborate a little bit on that and what type of teaching training would go on there? Just on mute.
Thank you. We are currently offering training to medical students, training to the GP registrars, but the number of rooms that are allocated is restricted because of the availability and the supervision capability here. We are hoping that having purpose-built building with proper supervision capacity and ability to be in one building, I think gives us that flexibility to not only train the medical students and the GP registrars, but perhaps think about practice nurses, other healthcare roles that we'll be able to train in the future.
Okay, thank you very much indeed. And also, just staying with you, if you don't mind, Dr. Donna Pudi, the site will support the practice as a way of expanding the health and care services that you offer there. Just tell us a bit about what other services might move into the new building.
Yeah, I think the current three sites are very restricted in terms of number of rooms availability, but also actually the available staff being divided in 3 places doesn't offer enough supervision. But again, I'm only talking about the health element of it. There are other service providers that the patients find useful, like Citizens Advice, maybe Benefits Age UK, or dementia teams and other people would might be able to have a room or place there. But equally, NHS we've now got primary care networks. These allow other roles and other clinicians to be involved, like the pharmacists, the paramedics, and pharmacy technicians. All of these people would be able to have space to be able to provide a holistic care to the patients.
Lovely. Thank you very much indeed for that, Dr. Donna Pudi. So we have had one question that's come into the inbox, and please do send us any additional questions. If we don't have any more other than this one, then we will bring the meeting to a close. So the question is, one of the East Anglian Daily Times /Star pieces that you showed had a headline referring to a bus route changes. Could someone elaborate, please? So a question about the possibility of a slight change to the existing bus route that would take in the new site. So Stuart Edgar, is that something you might be able to answer there, please?
Yeah, so at the moment, the bus routes that come into question, our transport statement will pick up that will be submitted as part of the planning application. That will detail the existing bus stops around the site and the proximity. The entire application will then be consulted on by Suffolk County Council Highways and Highways England. So it will be within their remit to see if they think the site requires additional bus stops and bus routes as part of our development. And I believe the Evening Star piece actually mentioned something. This was on the back of our public consultation events a month or so ago. There was a comment from Ipswich Buses operator saying that by the time the building is fulfilled, they intend to have, or realised rather, by the time the building is built and put into use, they intend to have additional bus routes in this area. Now that's something that's out of our direct control at the moment, but because SCC and Highways England get consulted on as part of the planning application, if it's something they think is needed and needed to be addressed, that's when it becomes handed over to those authorities.
Thanks, Stuart. Just staying with you, if I may, what are the next steps? So in terms of you mentioned your consultation, obviously this is a separate engagement where we're finding out views from local people and we're explaining exactly what the proposals are. What are the next stage once the engagement, once the business case, if it was to be approved, has been signed off from your perspective?
So we're readying at the moment at KLH Architects the planning application, and that's on behalf of Ipswich Borough Council as our client and NHS. We've already been through a process of having a pre-application submitted, and that gave us the roadmap in terms of what information was needed for a full planning application. So we had to look at the ecology measures, obviously in trees that will come into standard process anyway as part of a planning application of this size, but transport will always be a big issue. We're also asked to look at site security. Safer by Design had comments, and the design that we had at that stage, probably 18 months to 2 years ago, I think the initial design has altered and evolved into what we've presented today. So it's already had some consultation with the local planning authority to lead to where we are now. We would now be submitting in the next few weeks once we get the last of our informations in, and it will then run through an 8 to 13 week planning process with the local authority. During that time, it will be consulted on by, as said, Greater Highways for Suffolk County Council and for Highways Authority. It also has other statutory engagements with other bodies. And once we get planning permission, we would then look to undertake detailed design in terms of the construction package. It will then go to tender, be priced up by local contractors before likely starting on site early next year is, I believe, the target at the moment.
Thanks, Stuart. So that's the outline of the next steps should this get approved and should the proposal get progressed. So we've got an additional question which has come in, this time from Councillor Darren Heaps. Thank you for your question, Councillor Heaps. The question is as follows. The current patient capacity of Cardinal Medical Practice is 30,000. Does this new development look to consolidate this number, or will there be scope to extend numbers further beyond 30,000, given new residential developments in Witton and northwest Ipswich? I think that might be another question there for Stuart, if I may.
I'll do my best on this. No, I've got it on the screen as well. Thank you, Simon.
Fine. Okay.
So it has, the proposals do include larger capacity than the 3 practices currently have combined. So there is an allowance in here for some local growth. I don't know the exact extent of that, but I think it may have been in the business case. We did the proposals based on a shopping list of room numbers and requirements that were provided, but I know that it was greater than the initial sum of the 3 practices, so there is some growth space here. And again, as mentioned earlier, the flexibility of spaces such as our training rooms on the ground floor means that at current the practices don't have that flexibility. So some rooms, when they're in use, will take out a greater use. If you've got a large meeting room that has a one-to-one consultation going on inside it, it may take out a 12-person room that could usually be used for group therapies or group uses or vaccinations. The flexibility built into the new design for the building, particularly these ground floor elements, means that we are able to chop and change the size of some of these areas dependent on use, allowing for more use to occur at once. So even though we are, we did say 29 clinical rooms, 11 nurses rooms and a minor operating suite. I don't know what the numbers of the existing were. I don't know if anyone has that to hand.
Does anybody have that figure at all?
It's currently around 30 or 31 rooms, but obviously not of the same, should I say, standards or capacity in a way.
So effectively, we've got an additional 10 rooms here. So we've got 29 clinic, 11 nurses rooms. So we've got 40 rooms in total. So yeah, increase of 10 rooms.
Okay, thank you very much indeed, Stuart. Well, the time is 5:30. We've got no more further questions, so I will draw this meeting to a close. Thank you very much indeed to our panel for their time this evening. Thanks to our attendees on the call. So thank you for joining us this evening with your questions. Thanks also to Sarah and Jared for all the technical work behind the scenes. So thanks for your support as well. We've got another live event taking place on the 17th of May, so that's next Tuesday at 3 o'clock. And of course, if you need any more information, please go to the website, which is suffolkprimarycare.uk/Cardinal Medical Practice. And we have one cheeky little question which has just come in, so I'm going to put that into the chat as well. Is that a new one? Actually, that's an old one, but it's been republished again, so we'll ignore that. Okay, thank you very much indeed. We'll see you on the 17th of May. Please get in touch beforehand if you'd like any more information. Thank you. Bye-bye.